The elderly are at risk of being taken advantage of by scammers. But what if I told you that the risk isn't limited to Medicare scams, phony subscriptions, or even false past due bill payments? Stem cell therapy scams are more prevalent than ever. Dr. Charles Lee, a practitioner of stem cell therapy at Regenesis here in Huntsville, held the Healing Power of Stem Cells Forum in order to debunk some myths, provide information, and inform the public of the risks of stem cell scammers.
You have one group of physicians that will want to do Artha Biologics, in other words, these stem cell or platelet-rich plasma procedures. They'll buy a bedside centrifuge, they'll draw a little bit of a sample from a bone marrow, they'll spin it for 20 minutes, draw it up, squirt it in, and say, I'm a stem cell doctor. Stem cell processing takes about 2 hours. The procedure is about 4 hours door to door. It's very complex and you have to do image guidance. So that's sort of the shammers. And then the scammers are the ones that come to town and they'll say, oh, we're doing Wharton's jelly stem cells, or we're doing placental stem cells, or we're doing amniotic stem cells. And they'll bus you back to Tennessee, or they bus you to Mississippi or Georgia, and they'll inject these frozen products from birth tissues. It's 100% a scam.
At Regenesis, they use patients' own cells extracted from the bone marrow or blood plasma. So what's the difference?
Now what we're doing is a procedure. We're taking your fresh live cells from you and we're giving them back to you. So we're exempt from that registration as a drug. But if you were to have a product that you could purchase on the market, it would have to be approved by the FDA. It would have to undergo clinical trials. Those structural tissue products don't. They're just registered.
Some companies inject frozen jellies or placenta cells advertised as stem cell procedures. But Dr. Lee says that the precise source of the products aren't always clear and that the cells might not even be living.
Those products are registered as structural tissue, and by definition they cannot be dependent on the metabolic activity of living cells for their function. And they don't work. They have been shown not to have any live cells in them. When you try to culture those products, recently they took 6 different products and put them in culture dishes to see if they'd grow. 0 grew. They took 6 patients with bone marrows from all the way from 40 years old to 90 years old to see if they would grow. They grew like crazy. So your own fresh live stem cells are the best solution to stem cell therapies, and it's the best product to use.
Putting the Valley first, Cindy Stallworth, WZDX News.